So this final video is just going to look at the critical care dashboard or work list. This is the critical care work list. It shows all the patients that are currently on the intensive care unit, and hopefully just talk through how we're going to use it during medical handover to ensure that we get all the information across, and if there's any jobs that are created during medical handover, I'll show you how we can input them as we go. So this is a list of the patients. You'll see that they've all got the same surname, don't worry too much about that. And there's a lot of information here. As with the M pages, this is all editable and you can change the components however you like. So you can edit layout configuration, you can move different sections. Not many of them are pinned, in fact it's only the patient that's pinned, so everything else you can remove and you can move. So if you're not too bothered about the acuity level, for example, you can remove that. And let's say, for example, if you don't think that safeguarding concerns or that labs need to be on this particular list, you can apply that and it will remove them from this list. So when you come to handover in the morning, you'll get a list of the patients like this, and you'll talk through each patient, and you can scroll through and bring up any information you want to. These headings will appear a bit better on a larger screen, and you'll be able to see more of the information. And you can expand these headings so that you can see a little bit more. So if you wanted to see a little bit more information about each patient, rather than clicking on the patient's name and bringing up their record, you can stay within this list by clicking just near the patient's name and bringing up this view here. Now this is called the iPass system, and it is relatively useful for having basic information about the patient and also for inputting basic information about the patient. So for example, if the patient is unstable, you can click that they're unstable, you can see what the patient summary says, and you can add in little actions here as well. So for example, you might want to update family, and if you press enter, that will save. So if you press save, that will save that as a job that you can then click that you've completed later. And you might want to say, for example, prescribe antibiotics. And if you click available to all, that'll create it as a job for everyone, so anyone else can click that and complete it later on. Some people use the situational awareness and planning section. If there's any comments that you wanted to add here, you can add them. If you want to have a look at the information about the patient, you can click on clinical data and it'll pull through some vital signs, it'll pull through all the labs. It'll show you what medications the patient's on, and it'll show you the patient's fluid balance. And it's quite useful to be able to look at all of those things directly from the handover list. If I wanted to bring up the iPass for another patient, I would just click the area around the patient's name, the box around the patient's name, and it'll bring up their information instead. And so you can see how you could end up working through a handover and just bringing up basic bits of information as you go along. And then if there's other information that you're interested in, that can also appear in this table, in this work list. So the CPR status of the patient's location, any actions that were relevant to the patient. So if I refresh that, that brings up the actions that I documented there. So that's quite useful just for making sure that there's any little jobs appear on the list. If there's any information about isolating the patient, and if the patient has any documented diagnoses and chronic problems. So this is the patient that we did earlier. You can see that she's got hypertension and ischemic heart disease. If there's any outstanding tasks such as VT, that will appear there. So it's quite a useful view just for making sure that all the basic jobs have been done. Illness severity, you can click on that there and you can change it directly from the work list, and you can click on all these various different aspects. It'll show you any information if the patient's got a central line in. So for example, this patient's central line is out of date. It's been in for a year and a month according to this, so clearly obviously needs to be reviewed. And ventilator information will appear here. Renal replacement therapy, oxygenation, airway information will appear here, and any daily targets that have been documented. This will appear a lot better on a large screen, which it is designed to do, and hopefully we will do when we're on the ICU and during handover. It's possible that this might preclude you having to do a Excel spreadsheet or a Word document as a list, but I think that is unlikely. But what you will be able to do is to transfer the information from here directly onto an Excel spreadsheet, so it should at least make populating the paper handover a little bit easier. Unfortunately, it's not possible to print directly from this in a way that, in a format that is useful, so we haven't been able to find a way to sort of stop having to do those paper lists, unfortunately. But this handover format will allow us to have information available directly while we're doing our ICU handover. So it will be useful if you can have this up on the big screen on the computer in the coffee room during handover, so that we can review patients directly. So that's the ICU work list, and that's the iPass, and those are the main areas in which there's going to be sort of changes in the way that we work on the intensive care unit. I hope that's useful.